Zika is a mosquito-borne virus. It has symptoms such as fever, rash, infected nerve cells, and other neurological problems. Zika can also be transmitted sexually.
As a group, we decided to focus on a specific subgroup and a specific location that is affected by Zika. For us, we decided South America, countries such as Bolivia, Colombia, Argentina, and Paraguay, also Brazil and a bunch of other places. They're all affected, and it's just one specific area that we wanted to look at. We mainly want to look at pregnant women because, like we said before, this disease can have mild to no effects, and about 1 in 5 or 1 in 4 people actually show symptoms, if any. But it's more dangerous for those expectant mothers because this can affect the fetus. It's very dangerous for them. A mother that is infected can pass it right onto the fetus and can cause microcephaly, which in other terms is just a smaller than healthy head and brain, which will cause many complications in growth. And other complications would include clubfoot, vision loss. Some fetuses will not grow at a normal rate, and it can also lead to miscarriages and stillbirth.
Our first intervention would be on education. With this, we would have different health education pamphlets, public service announcements, handouts, anything that would be able to help give the information to the public in an easy and accessible way so they could be able to know how to educate themselves on what Zika is, how that's affected them and how it can affect others, the symptoms, the different ways to treat it, and so forth. They basically just the overall education that is able to give these individuals so they have the knowledge of what Zika is.
Another intervention is healthcare professionals. We plan on giving them adequate training to help provide care to those with the Zika virus and also to help prevent it. We also plan on giving them materials to give to patients to help them prevent the Zika virus. We also feel that having a knowledge of the Zika virus alone isn't enough. We want to give them supplies and tools to help those who have been affected by the Zika virus.
Another intervention that we have is one in regards to pest control. With pest control, they're able to go out and kill these mosquitoes in these dense populated areas. Some of the ways that they can do this is through fogger trucks that they can go out and they can drive up and down the streets and be able to release this fog that will go out and kill mosquitoes. They can do this within fields, and they can help these areas that have dense mosquito populations. Another way is to be able to eliminate standing water. Whenever there's standing water in these areas, it's a high breeding ground for mosquitoes. They're able to lay their eggs on the standing water and be able to breed and be able to have them right there in your own home. Big breeding ground for mosquitoes. And so by eliminating this, it stops the mosquitoes from breeding and stops them from being within the individual's houses or homes or communities. It's just a good pest control technique. With this also, it eliminates the standing water just because the fogger can only do so much. And when you actually eliminate the source of breeding, you can be able to do a significant amount of pest control. So it's very important for them to know that standing water is a high breeding ground area. And there's a lot of water in these countries, and a lot of standing water, and it's going to help eliminate the mosquitoes in these populations.
Our intervention of education will help many women who do not know anything about Zika virus. Since Zika affects women who are pregnant and can be dangerous for their embryo, knowing more about the Zika virus will help these women be able to prepare and plan and know the symptoms in case they ever contract it. Using healthcare professionals as interventions will help provide care to women who are pregnant. It will help us be able to focus on those women and provide care through people that they trust most. Our intervention of pest control will help provide protection to women who are pregnant. It will help people who are in high-risk areas or areas with lots of mosquitoes be protected against the chance of contracting Zika. To implement our plan of education intervention, we plan on taking flyers and other materials to places in South America that are at high risk for Zika virus. We plan on using institutes such as schools and healthcare facilities to help with this. To implement our plan of healthcare professionals, we want to focus on working with healthcare professionals that travel or volunteer in South America, specifically those who work with pregnant women. By doing this, we hope to be able to help them support women and prevent women with children and or pregnant to take care of this disease before it affects them. To implement our pest control intervention, we want to work with groups like WOW, who travel and bring supplies to South America, so that we can work on funding to help prevent and take away the risk of Zika.